Welcome to the Three Shires Hospital, situated within the beautiful grounds of St Andrew's Healthcare in the heart of Northamptonshire. On the day of your surgery, please report to main reception at the time stated in your letter. You will be met by one of our friendly reception team who will have some paperwork for you to fill out. You will also need to have the car registration of the vehicle dropping you off to input into the tablet. After this, you'll be taken to your ensuite room where you'll be shown the facilities available to you during your stay. On the morning of your surgery, you will be greeted by your consultant. They will confirm with you your chosen surgery and double confirm your consent form. They will check for any changes since your last meeting and draw an arrow on your chosen leg. The nursing staff may also be present at this time, completing their necessary checks and general observations prior to surgery. Once you and your consultant are both happy to proceed, you will be asked to sign your consent form once more. Following your consultant, you'll be visited by your anaesthetist. They will proceed to ask you some general health questions and confirm any previous experiences with surgical procedures and advise you on the best choice of anaesthetic for you. They may need to listen to your heart and lungs to confirm they are happy to proceed. The resident medical officer will come to your room and speak to you regarding any current regular medication and prescribe them for your stay with us. They will be your primary doctor for medication whilst in hospital, being overseen by your consultant. Your physio will then arrive prior to surgery and bring any necessary equipment and paperwork. You will be able to practice and re-familiarise yourself walking with your crutches, which we will practice today. Your nurse will then return to your room to complete any final paperwork and to ask any last questions. If you are able to, you will walk down to theatre with your nurse and meet your anaesthetist. The theatre team will take great care of you during your surgery. After your surgery, you will wake up in the recovery room. Once the theatre staff are happy with your observations, your nurse will come and collect you and you'll be taken back to your room on your bed. After returning to your room, the nurse will complete your observations every 30 minutes and when you are ready, they will offer you a choice of food and drink. Once you have eaten and feel well enough, you can ask the nurses to try standing or walking if you wish to. The morning after your surgery, your consultant will come and see you to complete the necessary checks on your joint and wound. They will advise the nursing and physiotherapy team on your progress. Your physio will come and see you to practice your bed exercises and assist you off the bed to start practicing your walking. You may use a Zimmer frame to begin with, but once you and your physio are happy, they will introduce the elbow crutches for you to continue with. You will also practice the relevant exercises following your joint replacement which may include standing exercises. Before you are discharged home, you will practice on the stairs or on a step, depending what is appropriate for you. This may be done on the day after your surgery. On the first day after your surgery, it is usual for you to have an X-ray. You'll be taken there and back in a wheelchair with assistance from a hospital porter. Before you go home, the hospital pharmacist will bring you your pain medication and explain when and what you are to take. It is important that you understand this and continue the same regime at home. When all the safety checks are completed and the team are happy for you to be discharged, you will be accompanied to your vehicle so that you may go home with a family member or your chosen carer. Approximately 14 to 21 days after your surgery, you will be asked to attend the physiotherapy department in the Cliftonville suite. Please bring your car registration with you to input as before. You will be seen by one of our physio team, who will carry out an assessment of your joint mobility and strength and your walking pattern. An exercise program will be discussed and developed around your goals and will be adjusted as needed over a period of up to 6 weeks, where you will slowly return to independent walking. Approximately 6 weeks after your surgery, you will be seen by your consultant. When you have reached your goals and are at a comfortable functional level, you will be discharged from the hospital.